The mother ended up paying an illegal fee to obtain the vaccination. For a good number of individuals in Nigeria, this occurrence is seen as normal, which begs the question, why? Mere observation insinuates that there are certain norms, specifically social norms, that help normalize such practices of corruption. But first, what are social norms?
Social norms are a set of informal or written rules that influence behavior or that make people think, oh, this is appropriate or this is inappropriate.
The Policy Innovation Center, in partnership with Besa Global's Corruption, Justice and Legitimacy program, sought to look at how gender and faith norms intersect with social norms to sustain the practice of unauthorized charges for free vaccines and commodities in primary health centers across 3 states in Nigeria.
We selected Nasarawa State to be the mixed state in terms of religion, and then we selected Kano State, which is predominantly Muslim. We also selected Ebonyi State, which is predominantly Christian.
The unique factor in this research was its focus on intersectionality.
I would define intersectionality as interconnected factors of social identities that collectively influence the way individuals behave and their experiences. In terms of norms, health workers expect other health workers to ask for informal payment before services being rendered.
A good example is
it's the community norms that drive the social norms that we have that is at play at the facility level. There is a faith and gender dimension to it. In terms of faith norm, right, how faith norm intersects with the social norms as a religious person. So you are not expected to collect bribe or informal payment in the facility. So what do you then do when there's a social norm that says that you're expected to collect informal payment in the facility? In situations like this, of course, there is also a conflict, right, that comes to play.
We have real Christians who really want to stand out. But at the end of the day, you are asked to provide something, some kickbacks.
For the gender dimension, females might not comply, right? So it's allowed. Why? Because there's a gender norm that female or women are expected to be nice, be kind, honest. The norm is a bit lenient on women compared to men.
We've observed that women will come to facilities and would like to relax, take their time, but men will come and are in a hurry. So for just coming to the facility, the providers are already agitated to either provide us or he's already influencing the normal routine of that facility.
Of course, health workers gave many justifications for this.
Most of the staff in the primary health care, they are voluntaries. They are not paying them.
The superior can equally influence other health workers to tell them to be collecting charges, unauthorized charges.
A condition whereby the consumables are not there for the health workers to use and work, they will now collect unauthorized charges from their patients.
So they need to collect this informal payment. Why? Because they are doing it for the greater good of the facility and all of that.
Money and getting money has become an end in itself.
It will be important for program design in future to ask the question, why are people corrupt? Why do they ask for bribes? Why do they take bribes? And if we figure out the why, the reason behind the behavior, then we can tackle the source of the behavior as opposed to the behavior in itself.
This affects health services delivery, access, affordability. This is an issue of behavioral change, so you need to look at what are the drivers of behavioral change. What can we do differently that we're not currently doing?
When we are doing our programs, we have to look at our programs from a multi-pronged approach, right? To ensure that as we are taking care of the norms, we are also looking at other factors and we have appropriate interventions to change some of these norms. As you are dealing with maybe the social norms at the facility level, you need to also go to the communities and try as much as possible to different programs work around those expectations. If you want to read more about the norms, particularly the intersectionality component, you have to read, or you need to read the report.